Hi, my name is John Garvin. I'm the president and founder of benicoltd, an employee benefits consulting firm based in the far northwest suburbs of Chicago. We are pleased to present this video about the history of private health insurance in the United States as one in a series of videos we have produced around employee benefit concepts and ideas of interest to owners and managers of businesses of all sizes. We want to share this information because, if nothing else, we believe it will provide the viewer with a cogent explanation around how health insurance has evolved over the years and why we believe that consumerism, like what we're seeing emerge now with consumer-driven health plans like health savings accounts, will ultimately be the key to providing access to affordable private coverage in the years ahead. The very first private hospitalization plan was implemented in 1929 at the Baylor University's healthcare facilities in Dallas. The very first plan guaranteed teachers 21 days of hospital care for a mere $6 a year, and was later extended to other employee groups in Dallas and then nationally. Blue Cross and Blue Shield plans then developed separately, with Blue Cross plans providing coverage for hospital services and Blue Shield plans covering physician services. The history of Blue Cross actually dates back to 1929, whereas Blue Shield dates back to 1939. Several large life insurance companies then entered the health insurance field in the 30s and 40s to compete with these new Blue Cross and Blue Shield plans. During World War II, wage freezes were imposed by the federal government, so employers got around this by improving the benefits under tax-free health insurance plans. Employee benefit plans proliferated in the 40s and 50s. This was at the height of the private sector union movement. And at that time, unions bargained for better benefit packages, including tax-free employer-sponsored health insurance. And then in 1954, Social Security was expanded to provide disability benefits for the first time. And then shortly after that, during the Johnson administration, the landmark bills for Medicare and Medicaid were passed and enacted. And that's, of course, changed the whole landscape of health insurance, particularly private health insurance in this country, because more than half of the benefits paid for our citizens come from those programs. And then in the 70s, we had the pension reform bill known as ERISA, the Employee Retirement Income Security Act, which actually reinforced the employer's role in providing health insurance benefits. Also, right before ERISA, the Federal HMO Act was legislated by Congress, and that really gave birth to the whole concept of managed care. And so for the rest of the 70s, we really had kind of the beginning of managed care, but also at the same time we had a model of health insurance, private health insurance called comprehensive major medical insurance. Originally, we were just looking at plans with deductibles and then some kind of co-insurance, 80-20 for instance, and then at some point the plans would pay 100%, but this was before there were drug cards and co-pays and all that. So shortly after the early 80s, then we saw HMOs and PPOs and point-of-service plans emerge as the prevalent form of health insurance. In fact, by 2001, 93% of private insurance was of the managed care variety. And then over the last decade, the clear trend has been away from HMOs and towards consumer-driven health plans, CDHPs, such as health reimbursement arrangements and health savings accounts, HSAs. While third-party payment has been prevalent for decades and continues to be, as a society, we have reached a point where we cannot continue this practice simply because it is not financially sustainable. Also, evidence has emerged that consumer-based insurance models like health savings accounts, coupled with higher deductible plans, are in fact bending trend and not only saving money but delivering on quality as well. While we have a ways to go toward improving price transparency, given the pervasive effects of third-party payment for over a generation, we nevertheless believe that forces are employed that are rapidly bringing about the changes needed to support more of a consumer model. So that concludes our overview about the history of health insurance and the emerging consumerism movement. If you have further questions about this subject or would like to consult with an employee benefits professional about how a consumer-based strategy can be employed in your business, please give us a call at 847-669-4800. We're glad that you joined us today, and we hope you'll take the opportunity soon to view the other videos in our series around employee benefit concepts and ideas of interest to owners and managers of businesses. Bye for now.